Well, hello everyone. Good morning and welcome to our webinar. Today's topic is cultural awareness in dementia care, and we appreciate you joining us. These complimentary webinars are brought to you through a collaboration of sponsorship with O'Connor Mortuary, Care Choices Hospice and Palliative Services, Caring Companions at Home, and Alzheimer's Orange County. And my name is Kim Bailey. I'm a gerontologist here at Alzheimer's Orange County, and I will be your host today. So our sponsors are providing these webinars to you as a service to our community on topics that are beneficial for anyone who cares for and works with older adults. We know that you will find today's presentation especially informative and useful. And today our presenter has come to us from Minnesota, and she is Dorothea Harris. Before I introduce her to you, I want to review with you what you will need to know if you're interested in earning CE credit today. So we'll go ahead and go to the next slide. Thank you. So CE credit is available for RCFE administrators, licensed RNs, and LVNs, and for LMFT, LCSW, LEP, and LPCC professionals through CAMP and the BBS. You must be online for the full 60 minutes. You must have access to both audio and visual on your computer. If you want CE credit, you can't share your link with others. It's a unique link just for you, and it is your record of attendance. If you share your link or use another attendee's link, you will not receive CE credit. There will be a series of poll questions that you must answer immediately. This is proof of your active participation in our seminar today. If for any reason you have difficulty submitting the questions, something goes wrong with the computer or whatever, you can always type into the chat box your response, just so we know that you're actively attending. If we don't receive any response from you, unfortunately, we can't give you your CE credit. Also, please complete the survey immediately as you exit the webinar. If you leave the webinar before we do, you will receive the survey on your email a little bit later. So this link is unique to you and your attendance, so don't share it with others, and make sure you do fill out that survey so that you can receive your CE certificate, which will be emailed to you within 10 days, as long as you've met all the other requirements. So in terms of basics for everyone, your mic and video are automatically disabled. That doesn't mean that you can't ask questions of our wonderful presenter. We will save those questions, and you can write them into the chat box, excuse me, and we'll save them for post-presentation. We've carved out a little time just to do a Q&A with Ms. Harris. So you can't use the raised hands feature because again, we're not responding to that. The way to communicate with our presenter is through the chat box and your question. Let's see. With all that, we'll go to the next slide and I'll tell you a little bit about Ms. Harris. Dorothea Harris holds a master's degree in social work and is a licensed independent clinical social worker. She is a leader and innovator in expanding critical caregiver support services, increasing understanding about dementia for both community members and professionals, and addressing the need for cultural awareness in dementia care. She is the visionary founder behind Cultural Dementia Insights. Her profound understanding of social engagement and senior programs equips her with a unique perspective on the challenges faced by our family caregivers. Dorothea continues to work toward diminishing health disparities and the isolation faced by underserved communities, ensuring that all seniors can access the services that they need and deserve. Let's go right back to your bio. There we go, and I'll finish up. Her ultimate vision is to create a model and a system that empowers seniors to age gracefully in their own homes, embracing independence with dignity, confidence, and joy. Dorothea continues to highlight that her proudest and most cherished achievement was the privilege of caring for her grandmother in her home from her 90th through her 98th year until her peaceful passing. It was an honor, she says, to provide her with care and love in her final years. So I'm very excited to have all of you meet Miss Harris. Dorothea, do you want to go ahead and go off of mute? And I'm going to let you take over and I'm going to go away. Okay?
All righty. So can everyone hear me? All righty. Well, thanks to the Alzheimer's Association for inviting me here. It's just a pleasure to be here with you, and a warm welcome to all of the participants that are on the webinar. So let's get into it. Tried to find a working definition of cultural awareness that was appropriate for our webinar today. And so this is kind of the closest that I came up to. So cultural awareness is being conscious of one's own cultural background and biases while respecting and appreciating the diversity of others, which includes the ability to communicate effectively across boundaries, adapting one's behavior and practice to be inclusive and respectful of diverse perspectives, and navigate cultural differences with empathy and sensitivity. So I kind of have a simpler term. I call it my own social work language. And it is cultural awareness is the ability to serve people in an appropriate way that whoever comes through your door, you're able to treat them with dignity and respect. And they acknowledge the services that you treated them with were acceptable. So, cultural awareness is serving people with genuine curiosity and kindness, making meaningful connections. And I stress that simply because when we're working with caregivers and we're working with people with dementia, I just think that it's just such a, not only just a precious, but it's a real volatile situation because we don't know where they are in their journey. And so we always want to respect them and know that it's not always your words. They're actually feeling, they're emotional at that time, and they're feeling what's going on. So I have to stress curiosity and kindness. So there's no need to be an expert in every culture or simply have all the answers. Just focus on curiosity and sensitivity. Just giving people dignity and respect. We have so many issues with language barriers and other cultural things, but we can always be respectful and kind. A particular person comes to mind when I talk about just using just kind gestures when working with caregivers and people with dementia. And this person says, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So if you know who that is, put that in the chat. I want to check it out later. Pretty famous quote there. So just wondering if you know who said those words, go ahead and put that in the chat. All righty. So my home state of Minnesota. I hail from Minnesota and went to school there, got educated there, and married and had my children. And so Minnesota is just dear to me. I have since relocated and I am in Houston, Texas now. I'm doing some uh, bigger things now and taking more territory. But Minnesota, the 10,000 lakes, beautiful parks, and of course, the cold winters will always be dear to me. Most of my career as a clinical social worker has been to African American caregivers, to their families and older adults. I was just blessed to be able to recognize as a young person the disparities and the health challenges that have been in families of color. And as I went to get my degree, I always wanted to stay in my community. I guess they used to call me an old soul. My mother would always say, go play, go mind your own business. You don't have to stay around the old folks all the time. So I think that was just an old soul that I had. So it was important to me once I got educated to come back and find out a little bit more about the disparities, especially when it comes to health, because I seen that people just didn't age well in Minnesota. They just had too many things going on, and it was very difficult for people to, make it into their 80s and 90s. There were such things as diabetes and heart failure, strokes, all of those kind of things were very prevalent to African Americans. So again, I've been summoned to another state. I mentioned Houston, and I'm full-time now doing some dementia coaching and consulting. And I'm focusing on cultural responsive healthcare and culturally sensitive interventions across the United States. So here we see that, again, African Americans have been hit hard by Alzheimer's disease. African Americans have the highest risk for Alzheimer's disease than any racial or ethnic group. I wonder how many people knew that. One of the biggest challenges is that African Americans don't know that. And that's one of the areas that we struggle with, is that there's just not enough education on dementia. What are those risks? And that was one of the biggest things that I was challenged with, is getting the word out that unmanaged chronic diseases are one of the biggest risks for dementia. So here we see more same disparities. Heart health and brain health are connected. African Americans, as I mentioned, have the higher risk of heart health factors like high blood pressure, high cholesterol, and diabetes, which are again associated with dementia. But I could definitely say that chronic health conditions, regardless of what culture or what race you're part of, they must be managed. And that's the word that we need to get out to people, that you must manage chronic health diseases in order to continue to age healthy and be strong, and your brain to continue to function. So that is something that's really important.
Okay, it looks like it's time for our first poll question. Audience, here's the question. African Americans have higher rates of heart health factors. Is that true or false? Go ahead and quickly select your response and submit it. Again, if you're having any problems with that, technical difficulties, if you will, you can also put your response in the chat box. So again, the question is, African Americans have higher rates of heart health factors, true or false? Okay, it looks like everybody had a chance to weigh in. So here are the results, and everyone did a fantastic job on this. Great job, and back to you, Dorothea.
All right, wonderful. Well, I was going to jump on that chat myself if anyone missed that, huh? So again, I want to stress that African Americans are at the highest risk. However, there are so many older adults. As you age, of course, you start having these older age health challenges, like high blood pressure and high cholesterol and, diabetes and things of that sort. But remember that they must be managed. So as the body goes, so does the brain. All righty, let's see. How do I get rid of that? All righty, and then the next one here. There we go. All righty. Well, I would be remiss by not sharing, by not sharing a bit of the Tuskegee study here, simply because it is something that talks about the culture of African Americans. And it's a sobering reminder of the need for caution when dealing with medical professionals. So you've likely heard about the reluctance of many African Americans to participate in clinical trials. And there really is a profound reason behind that. It's just not wanting to be involved and uh, don't understand it. There's history behind that. And here, I'm just going to touch on a couple of things, but there were 600 African American men that were injected with the virus, or I was going to say COVID-19. Of course, because of this incident, when we came out with COVID-19 and it was a shot that you needed to take, of course, there were people that were, kind of taking the back seat about that because they just weren't sure and they were very not trusting because of the old wounds that have been in the community for many, many years. I remember being 10 or 11 years old when my family started talking about that. However, what's important about that is they were not told. They were totally misled, and 600 men actually were giving that virus, that antibiotic. I shouldn't say antibiotic, but were giving the syphilis shot. And so they actually got syphilis. And the implications of that were just horrible. It was devastating. Spouses were infected and families torn apart, and children born with congenital syphilis suffering severe health consequences ranging from neurological impairment to physical infirmities. And I have to say that this was done on behalf of the United States Public Health Service. And so it's more of an institutional thing that people are just, you know, really wanting to be cautious when they hear clinical trials. It just evokes a feeling of mistrust. But I have to say, not only for African Americans, but within many other countries, there's been experiments, medical exploitation, and clinical studies that have really shown medical professionals not to be trustworthy around Hispanics and Asians and Africans. So this simply is not the platform to talk about all of that, but I want you to know that that is culture and that is history for a lot of people. And you don't want to act like nothing ever happened. You want to just be open and acknowledge those things. We've certainly come a long ways, and we're conducting better ethical clinical trials. However, these inflicted evils that have happened, they certainly take time to heal. So old wounds can be slow to heal. And I just know that, for the medical system, we all have to work together to be able to get past this. Um, these are deep rooted trauma, and it still weighs in the community now. So this is about Granny and me. We really spent time to communicate and talk and chat about, history. It is my culture to really take care of our elders and to cherish them and know that as they get older, that it will, almost like a role reversal, it will be our turn to take care of them. And there were many times when I was growing up that there were elders that didn't have places didn't have family and didn't have places to go. And my mother and father took them in. Oops. So that's just a cultural thing that I have. My granny, when she lived on her own until she just couldn't do it anymore. And so the family had to select a caregiver. And I was actually selected to be her caregiver. And I literally was so ready to be her caregiver. I was excited about caring for her in the last years of her life. And it was actually a joy. It was just an honor to be able to give back what she had actually given to my family and I. So I do know a little bit about caregiving and unconditional love and sacrifices of being a caregiver. All right, so let's move on to some celebrations of working with other cultures. So I'm pictured here receiving the Commissioner's Circle of Excellent Award for outstanding services, serving diverse populations at risk for facing Alzheimer's disease and dementia. And this is from the Minnesota Department of Human Services. So there were many lessons that I learned as I was serving the community in this capacity. And those are some of the things that I'm going to be sharing with you today. So initially, my task was to work with my own population and in my own culture, African Americans. And so that is what I set out to do. And because there was not enough education, not enough services, not enough support, that is where I focus my attention, is to get out there and let the community know that I'm going to be culturally sensitive and I am going to be the go-to person if you're dealing with dementia, if you're having some challenges with caregiving. I developed a health team of social workers, community health workers, local volunteers, and really made it a point to highlight that there is a population out there that is really become vulnerable when it comes to trying to stay at home, have home and community-based services. One of the reasons is what I just talked about. They're just not in a hurry to go to the doctor or, go to the hospital about things. My family always said, whatever happens at home stays at home. And so it was just a trial, just trying to deal with, illnesses right there in the home. So I was able to get some brain health education going on. People started coming out for that. I developed caregiver support groups. We started doing dementia screening, found evidence-based programs, and really, really, really worked hard to put programs together for African Americans. One of the things that really stood out was the collaborations that I was able to make, simply because people really wanted to support and help, but you know how nobody wants to be first, right? And jump into things. And so even our Minnesota Alzheimer's Association, gave me the biggest support, the Mayo Clinic, University of Minnesota, just many healthcare organizations and local clinics came to be a part of us establishing support for African Americans and caregiving and aging and getting education and, really trying to get back on track. The disparities, just the numbers, look absolutely horrible for Minnesota and how people are faring there. So as this was taking place, I believe I was doing it, I don't know, about 5 years. And, it was starting to pick up traction, and it garnered widespread recognition. And it led to a $1 million grant. So, of course, with the $1 million grant, that actually came from the Federal Administration for Community Living. It was such a big deal. And all I could think of to do that would really make a big bang was to buy a mobile clinic. It was important to me to get to the community where people lived at so we could really serve them. And that was one of the ways that we worked against those that, are at risk for dementia, was to get in there in the community and start doing some screening, start doing some education, really helping people to value their health and to be responsible and accountable for their health. So this is the mobile clinic that we had here. Absolutely fabulous. This here is our news anchor, Channel 5. And we did everything we possibly could when it came to outreach. We actually went into, all the different communities. We went on radio. We were on TV commercials. We went to wherever seniors were at. We were actually there. And as you see this picture here, one of the requirements for the $1 million grant is that not only do I work with African Americans, I have two other groups that I would be assigned to work with, and that would be the East Africans, mainly Somali, and then the Hmong Americans. And so as you see this mobile clinic here, I made sure it was dressed to appeal to the target audience of who I was selling. So I thought it just absolutely looked fabulous in the community or wherever we went. People really gravitated to it and wanted to know, how do I get some services? What do I need to do? And they knew that it was the biggest, shiniest thing that was out there. All right. So, a little bit more about our mobile clinic. I took it upon myself to make sure that each culture had their own health representative, especially because we were dealing with language barriers. And so, for the East African population, that's exactly what I did. I went and got health professionals that were willing to come on the mobile unit and to serve their own people. And I just can't tell you how people were so excited to have medical professionals that were of their culture to be able to spend time and to help them to understand, as well as give them the physical examinations, memory screening, memory diagnosis, warm handoffs. It was phenomenal. People were just lined up to come. And one of the greatest things, I keep saying one of them, there must have been 100 of it. It was just a astounding, brilliant thing to do for people of color, was that the medical professionals, whether they were East African or if they were Hmong or just African Americans, they were so honored and proud to come out to serve their people. And I remember getting a call from one of the gatekeepers of the East African community. And he had said to me that, I believe it's soccer, something that they play, soccer or something, that they were having a big event and people from different states were going to be there, and it was going to be at a huge field there in Minnesota. And if I could bring the mobile unit, he was a neurologist at one of the hospitals. He said he would bring a team of doctors and nurses, and they would serve their people at that time. And so, of course, I was delighted to do that. And I mean, just to see that, there had to be hundreds. We were there almost 2 days. Just, they came out, they were just so elated to be served by their own people. And the same thing for the Hmong. I went ahead and got the nurses and the medical professionals for them, and they were just delighted. It really was a healthy aging. Oops, that's not a good sign there. Let me make a change here. All righty. It really was a good sign of the community really wanting to be educated and really wanting to be healthy that we started various health groups, helping people to learn how to eat better, just really did complete wraparound services. We had a helpline. I hope that you can see that down here. And we had it in different languages. See if I can move that down there. Good. We had it in different languages. And so people were able to call the line, find out where we're going to be at next. They were able to tell us if they were dealing with any challenges. They were able to connect with their own representative there. So I had Hmong staff, of course, and East African staff, and they were just delighted just to call someone to talk about their health and what was going on. And it was just a great service to share with them. We also have some statistics up here of dealing with the three communities. Down here to the left was Dr. Brown. He's a neurologist, and he actually would come and have a team. And the mobile unit had two clinical rooms, and so it was a nice space there, of course, with a bathroom, and it had sinks and it had a waiting room, and it was just the ideal thing to have to really get in there and um, make a difference in the community. All righty, so just a little bit about the cultures. So I was really dealing with some huge numbers here. So here in Minnesota has the largest Somali East African population in the United States. And here we see that the Hmong population is second only to where? California. And St. Paul is home to the largest urban population of Hmong in the world. So there is a lot of education, lot of training that needs to be done when it comes to dementia, Alzheimer's. These families, these cultures did not even have a word for Alzheimer's. It was just a mental illness or being crazy, or that's what old folks do. So that's actually where I had to start off with when it came to talking about what's going on, which was a lot of work. But they wanted the support and the help, and I tell you, we actually ended up going to you know what? I wanted to make sure, and I'm sure that you have the screens, but let's see if I can go back. Yeah. So on the helpline here, my successor, you see where it says the helpline? I'm trying to move that out the way so you can see that. And oh, okay, maybe I could put it up. There we go. She is still there. So she she knows that I'm doing this because she wouldn't do it. So here's the helpline number if you want any further information or just talk about anything about she was with me while we actually went through, this was a 3-year grant. So feel free to give her a call. It's called Culturally Responsive Caregiver Support and Dementia Service. The mobile unit was the first of its kind. And I think that if you're looking at doing anything like this, we certainly have a track record of doing it very well. So again, these populations, we really started at the beginning of, them trying to find out what's going on in their lives, and so very appreciative. And again, it's not about speaking their language. I did hire staff. I did want to do uh, anything else but give them the care, respect that they wanted, and so I made sure that I had staff that they could talk to, whether they called or they came in or on the mobile unit. There was always someone that they could relate to. Let's see. So, a couple of stories about each group.
Oh,
The Hmong.
hi everybody. Sorry to interrupt, Dorothy. I just wanted to give you about a 15-minute warning, so we can
Oh,
allow time for Q&A at the end. Thank you.
okay. All righty. So, have we done all of our polls yet, or are we about to? Let me take a look.
No, we haven't done, there's still some polls left.
Okay,
Thank you.
sure. So I better get going. I had one of my dearest seniors that is passed now. She always said, whatever you do, make sure you have fun at it. Otherwise, it's not worth doing. So I had a fun time making these slides for you. And I probably made a bit too many of them for you, but I just wanted you to see the magnitude of the work that we did and all the fun that we had. Okay, so let's see what's next. All right, so now here are actually some of the lessons and things that I actually learned that I wanted to make sure that I shared with you as we talk about cultural awareness in dementia care. And one of the most important things is being open and willing to not try to bring people into what you know and how you serve, but to be open and flexible to them. And I love the phrase, uh, recognize and celebrate the diversity within the populations you serve. I really love that. This project really helped me to appreciate people for who they are because we don't get to say who we're going to be, right? And so, really appreciating the richness and the different cultures and how it just makes us have a better world. So, let me keep going. Um, so, one of the most important things, whoops, that I'm still learning. One of the most important things is we have to rebuild trust. Again, it's for all cultures, different things that happen, when we weren't um, doing things the way that we should have done. And people have gotten hurt and, people are traumatized and, we lost lives. And so we have to be careful how we work with people because we're trying to build trust. We want everyone to have quality care, especially again when you're working with various cultures. I made it a point to go out to meet medical professionals before I referred them to the cultures just to make sure that they don't run into some of the things that we've seen or heard, or that they would get a nice reception, making sure that they're going to get the quality care. And the big picture is we're trying to reduce disparities, and it just doesn't happen by itself. We have to make an effort to do something. All righty, so now this is kind of shocking. Oh boy, let me go back again. Here we go. This is kind of shocking news, but I remember in college they talked about the browning of America, and college wasn't 10 years ago, so it's been going on for quite some time for sure. And it was a very interesting article, The Browning of America by William Frey. And again, it's just talking about, let me see, I had some statistics that I wanted to share about that. It's talking about just kind of the changing of the guards in regards to some of the other populations that are really growing and growing rapidly and becoming very large. So it's the Hispanics, Asians, and multiracial Americans, and they are going to be soon the largest populations. And it says the Census Bureau tells us that in about 30 years, white Americans will no longer be the majority because these populations and cultures are really making that demographic shift, which is called the browning of America. So yeah, check that out. Very interesting. So how much more do we need to prepare for a diverse future, especially in dementia care? So I've been privileged to be able to collaborate and partner with a senior caregiving company right here in California. And they are doing phenomenal work reducing healthcare disparities and isolation among disadvantaged communities. And so I have to raise that up and make sure that you know that they're really trying to work with people of color, especially Black communities, to make sure that they have access to vital care. I was in a meeting and met Anna Jones, and the name of her organization is called Flex, PHLEX 65 and .com if you want to go check it out. I think that we put it in the chat, Kim, right? But I knew it was right there in California, and so I wanted to make sure that I mentioned it to you. It's flex65.com, and I'm partnering with that organization, and they're doing some phenomenal things. I tried to make sure that you had enough information that you could take away with you. That's why your slides are full. Okay, culturally sensitive dementia care strategies. Again, I went out to the community and I met the gatekeepers. That's so important when you're starting something. Oops. That's so important when you're starting something new, is to make sure that you're connecting to the gatekeepers, that they know that you are doing something that's going to beneficial their community. And so I'm thinking about the Hmong. We actually, my team and I actually went to meet with the shaman, and they like to do spiritual blessings. And so we got a chance to educate them about dementia and Alzheimer's and became partners working with the African American church and the pastors there. We also, with the Africans, we went to the mosque and met the imam. And again, these people were very open and very receptive to learning about dementia and, what are the signs? I mean, this is the Alzheimer's Association that we're working with, but these people didn't have this information. They didn't have the 10 warning signs and they didn't have all the risks and all those things. So people were really, really eager and thankful to have us and to learn. Now I see a poll question coming up.
Okay. And by the way, Dorothea, Lauren did put the information about flex.com into the
Great.
chat box for everyone.
Yeah.
So this is our second poll question. It's a true false. Family members should not give their input about their loved one's care. Okay, it sounds like this is going to be shared after the fact with this poll question, but that's okay. Everybody go ahead and answer it the best you can. Family members should not give their input about their loved one's care. What do you think? Go ahead and submit your answers, and we will go ahead and release those results. And almost everybody got it right, so that's great. And back to you, Dorothea.
All righty. See if I can take this off here. Yeah, so as I shared, is there a hand up? What is that? Okay. So as I shared about the different populations, especially the Hmong and the East Africans, those are huge. Those are large, large populations. And so you would never, ever do anything without the family being a part of what's going on. So I don't even care if they didn't want the family to be there. You would know that the family needs to be there at all times. Okay, multilingual support in dementia care. Boy, I read something the other day about some type of medical translation that they have. And, when I actually ran this program here, it was, I believe, about 2018. Things are so much more sophisticated now. And they have so many different types of translation programs. And so you don't have to put that on yourself because you're dealing with a population that speaks another language. You just need to get the services where people can communicate. And then in regards to the materials, it's so important to make sure that you have materials, not only just in languages, because a lot of them don't speak their own languages, but making sure that you have pictures and you have things that appeal to them. But there's just not enough information. I'm sure the Alzheimer's is, I mean, it's been 5 or so years, have the information that looks like people and they want to get their hands on that material. Awareness of biases and privilege. Let me see here. So this is really kind of touchy to me because we just don't think that we're biased. But everybody is biased. Everybody's biased. We all have biases somewhere. I have to tell you a quick story. You know how they have those lunch and learns for, um, I went to one that was by a neurologist that was talking about dementia, and the room was filled. I live in Minnesota, and so I was the only person of color, the only African American person at the lunch and learn, and there probably was about 50 people there. And when it was time to get up to go through to get your lunch, these two girls had brought their mother who had dementia, and she had to pass me by. And she said, "Who is that black woman there? She's not supposed to be here. Who told her to come?" And of course, I knew exactly what was going on, that it was some old baggage, how a dementia is like an onion, and when you get to the end, all that stuff is coming out, right? And so I certainly knew what was going on. However, I'm sure that her daughters didn't think that their mother had all that in her, that she would be talking like that. And so there had to be some things in that family and household where that came out of mom like that. It might have been hidden for a long time, but I think that everybody should go through bias and privilege um, education because it's there. And uh, dealing with people with dementia and caregiving in different cultures, there just literally is no place for it. I mean, these people are really stretched thin, and if it doesn't work for you to work with them, then you definitely don't you don't want to traumatize anybody. But it's very important. And Kim, I meant to put a link in there, but if you would just Google that kind of training, I'm sure that you'll come up with something. But there's just no room for that, and so you know, be sure and take the training that's needed. Yeah, so it was the Harvest ED implicit bias training. So check that out. All righty. So barriers to care for communities of color. These were the three that stood out. So I put them together for you here. I have to highlight dementia, stigma. There is such a stigma still, I'm sure, still around in regards to dementia. People don't know if somebody's going crazy, mental illness. I got calls all the time for NAMI because, especially if it was an early diagnosis, it couldn't be dementia, and so they thought it was mental illness. And people just didn't know about those behaviors or any of that stuff. And so, again, it's important to, really kind of dispel some of those things. And the best way to do that is education. And then, cultural resources, make sure that you have things that look like people if you're working in that culture. You don't need to know everything, but you need to work and communicate with the cultures that you're working with. I don't know how many times I've actually went in some place for services and, they just, it wasn't inviting. And that's the first thing that you want when you go somewhere is to know that, they're welcoming you. It's okay for you to be there. Yeah, again, I want to stress that family caregivers carry so much shame blame, and embarrassment. That event that I dealt with at the Lunch and Learn, I mean, those girls were terribly, terribly sorry and were so shocked that that came out of their mother's mouth. And so, you know, that atmosphere is always real sensitive. Caregivers and dementia. I always say that doctors have two patients, not one, but two. Cultural centered best practices. I have to really stress that best practices are really what work. A lot of these cultures have used things for a very, very long time, and they have their various rituals and traditional things that they do. And you know, I never look down on them simply because we don't even here in the United States have a cure for Alzheimer's. So I mean, whatever you do to try to deal with the you know, the behaviors and you know, just everything that comes with having dementia, and you find something that works, you know, use it. My favorite line is, "How is that working for you?" One of the other things I will highlight on here before I move on is cultural partnership. There were so many organizations that stepped up, that really wanted to help us, wanted to support us. We had a nurse group that would come out, and as we provided, it was caregiver breakfast. They would come and work with the people with dementia. We had all kinds of organizations and institutions that really wanted to get on the bandwagon. And I think that this really brought more reality to what is going on out there. I mean, our aging population is really needing us to be there for them. How am I doing, Kim? Okay.
Yeah,
Integrating
I think
culture.
just keep moving along and you're doing fine. It's great information. Thanks.
Yes, thank you. Integrating cultural awareness. This is something that we are going to have to just start integrating. You don't wait until the population changes. We're seeing it now. Like I said, I've just relocated to Houston, and I mean, there must be 100 different cultures there in Houston, and so you know, I'm embracing and learning now, um, just to be kind and accepting and smile and be kind and be kind. So I would say if you're in a big church, if you have a practice, you go to the gym, wherever you go, you know, it's going to be various cultures. And so we are going to have to live together and work together and support one another the best that we can.
Okay, it's time for another poll question. True, false. Cultural awareness should be integrated into day-to-day practices. Audience, is that true or false? Go ahead and quickly select your response and submit it so that we can get back to our program. Cultural awareness should be integrated into day-to-day practices. All right. I think everyone's had a chance to weigh in, and 100%. Good job, everybody. Okay, back to you, Dorothea.
All righty. Yes, thank you. All right, empathy and compassion and caregiving. This Flex 65, boy, they've got this sold up. They do this so very well. I wanted to share, it's called The Fruits of the Spirit, and it's in Galatians 5:22 and 23. One of the important things that not only are real support for persons with dementia, but also for different cultures when you don't know people and you see people in various settings. But it talks about the fruits of the Spirit. And these are things that surpass communication and surpass touching and all of that. And there are 9 of them, and it's love, joy, peace, patience, goodness, kindness, gentleness, and faithfulness. And I know when I'm around different cultures, I want to be kind. I want to be good to them. I want to be patient with them because they don't know the English language. And so it takes time to really get acclimated. And I worked in a senior center, and there were just cultures from everywhere. And I noticed that they watched me carefully and they wanted to see if I was approachable and touchable and, could sit with them. And so know that people want to um, want to be part of whatever is going on. It's just that we have the barriers of language and we have the barriers of not being patient. I initially started off with the groups together, but that language barrier is nothing to play with. So make sure you're respecting people by having translations done or have someone that speaks their language. But when it comes to empathy, that's so vitally important with caregiving and dementia. So I would encourage you to, whatever you can do to really soul and support the caregiver, the person with dementia. We all know this. This is something that is really, really tough to deal with, but give it your best. I think I'm almost through. Yeah. So culturally aware questions for caregiving. Ask about cultural factors, talk about these kind of things as a caregiver and you're putting your person with dementia, maybe you have to do a nursing home or respite care or something like that. I just drafted up about 30 questions asking, what have you done to prepare for the particular culture that is going to be coming to their facility? And, they always say, oh, we don't see culture or color, everybody's the same. And now that's the wrong answer for sure, because we know that we're very different. And I remember putting a African American family into I believe it was assistant living, and ask them the questions, and they're trying to get things together, and 6 months later, there is nothing hanging up on the walls that looked like African American. The food, the diet hadn't changed there. No activities that would support these people that were there. So you really have to take time and teach people. I mean, I sometimes I think people want to do well, but change is hard. But we know what's coming down the pipeline, and so if you know to do the right thing, please, let's start talking about this. All right, so take action. Healthcare professionals and caregivers are called to action to weave cultural awareness into every fiber of dementia care practices. That's so important. I was in an emergency room with a senior, and I don't know if the guy came from Lebanese or what, but they had actually had blankets for people from different places. And that was their gift to him while he was there. And I thought, how considerate, how wonderful thinking ahead. I mean, everybody's going to hospitals and things. And so just to think ahead and to start putting this into day-to-day practice was absolutely wonderful. The change isn't just a small improvement. It's a big part of what's making caregiving work well. Remember that caregivers are the backbone of our society. When you look at the cost of this expensive disease, know that there are millions of people at home that are doing this. And so we always have to really honor the caregivers that are making this work in their homes, especially when they're coming out to, an adult day program or whatever it is that they're doing. We want to honor them. So learning about different cultures is a journey that never really ends. I thought I had a handle on things in Minnesota, but now that I'm in Houston, I've only just begun. It means staying committed to learning. That is all I have. Okay.
Okay, do you want to go to the next slide?
Oops.
There we go.
I did it. I did it.
You did it. And it was fabulous. Just absolutely fabulous.
Thank you.
So we're
Thank you,
getting a
Jen.
lot of accolades in the chat box, and I'm sure we'll get many more on this surveys, Miss Harris, but we're
Okay.
delighted that you're with us today. And so
Oh, it's
now
fun.
just a couple things that I have
Oh.
to make note of. One is that we are running overtime. So if
Oh,
people
wow.
need to leave, they can. If you're convinced you have your 60 minutes for your CE and you need to leave, we understand that. But otherwise, everyone go ahead and put your questions into the chat box now. And I just want to take this opportunity to, of course, thank our wonderful sponsors, our longstanding sponsors, again, of this webinar series, O'Connor Mortuary, Care Choices, Hospice and Palliative Services, Caring Companions at Home, and us, Alzheimer's Orange County. We appreciate that so much. And I also want you to please take note of next month's continuing education webinar. It's hearing loss and dementia in older adults. And that's on Tuesday, June 11th, hearing loss and dementia in older adults. And we have an additional webinar for you in June on the 14th in honor of World Elder Abuse Awareness Day. And it's Curbing Financial Elder Abuse, a national and local perspective. So that's on Friday, June 14th. So those are two important webinars. If you didn't have a chance to take note of those, you can always go to our website at www.alzoc.org and learn more about the many educational offerings that we have. All right, so let's get to the questions now for our presenter. And the first one I saw, and you probably covered this, they asked it very early on in the lecture. Are these disparities due in part to lack of good medical care over lifespan, and or even related to diets not being managed well? So
I would say that, yes, that and probably more. I'm sure it's not, just one or two things. I'm sure it's due to, quite a few things. So, yeah, as the body goes, so does the brain and the mind, and I could mention the social determinants of health. I mean, where people live, environments, so many things that would probably contribute to that.
absolutely. And, they're asking about medical care. It's well documented that there are groups that do not receive the same health care that Anglo groups do. So that's pretty much all through the literature. Yeah. And then here's a question for you. Is smiling well received by most cultures?
Yes, absolutely. I like to smile. I'm a happy person, God has been good to me. And just being around some of those other cultures, especially the Hmong, when I came into the office, and you know what I mean, I just didn't get a chance to put my smile and stuff on. The Hmong ladies would come and just do my shoulders and just try to relax me a little bit, and got me to smiling again. So all of those things that I mentioned in regards to the fruit of the spirit, being kind, being good, being gentle, we got to get back to just those simple things. So smile and plus 10 other things.
Absolutely. Couldn't agree more. Do you know about any places that they could gain information about Alzheimer's disease as it relates to Native Americans?
So where would this person be at? I mean, other than, going online and finding things, are they there in California?
Well, we do
Oh,
have,
who knows?
who knows? We have people from all over. A lot of our folks are from California, but I imagine, they're talking about those social determinants of health that you mentioned.
Sure.
So
The biggest factor for dementia is age, right? Right, Kim?
right.
And so anybody that's aging, you're in that number, right? And
Yeah.
so all the cultures and groups are really doing things. They're really stepping out. And I've been to Native American events and done talks. And so I know that they're there. I know that they're active
Yeah.
and involved.
Good. Um, oh, that's not a question. They're just
Oh,
saying you're a treasure.
oh, okay.
How
Great. Thank you.
nice.
Thank you.
How nice is that?
Yeah.
Um, yes, thank you for information and education. You're an asset to the dementia population onward and upward.
Onward and upward. Yeah, I'm excited about moving onward and upward.
Do you recommend any books or manuals to read regarding cultural awareness, particularly with the groups that you were discussing?
Yeah. Our Alzheimer's in Minnesota, North Dakota is doing a wonderful job. I don't know, Kim, if you guys have started putting together a lot of cultural stuff these days, but they're doing a good job putting some things together and have some, people of color on staff. I mean, this hasn't always been, you know what I mean? But we're seeing that, who's at the highest risk here for Alzheimer's? You got to get ready for that too. So, other than what can be found online, there's so much stuff out there. Anything in particular, I don't know. Yeah, I don't know, but I know that there's a lot of things that are out there that are available. I particularly are drawn to things about people of color that are dealing with dementia, and again, it's a cultural thing, and so
Yeah,
a lot more information out there.
absolutely. Someone's commenting back about the Native American population.
Oh, oh,
We need to be careful with Native Americans in health since the leader of each nation needs to be consulted.
that's right.
Yep,
I think I said something about,
yep,
the stakeholders, key people. You don't go in and just deal with their folks. You know what I mean? There's a right way to do that. And I respect and honor that.
absolutely. Um, does do people's status affect their ability to receive these services? So I don't know whether they're talking about your particular services, the mobile van,
Yeah.
or
Uh-huh. Uh-huh.
does their status, and I don't know whether they're talking about their socioeconomic status or what. Mobile van, yes, they're saying yes, economics. So let me reframe it.
Okay.
Does people's social economic status affect their ability to receive the services of the mobile van?
The key thing was with the mobile van was healthy aging and memory and dementia screening and care. I mean, that's what that was all about. So it was $1 million grant. So anyone that came were seen.
Okay, wonderful. Any other questions from the audience? Okay,
All
well,
right. Yeah.
um, Ms. Harris, we thank you
Mhm.
so much for your contributions today. They were very well received and very much needed. And so we thank you for sharing your time and your expertise with us.